Hello. It's been a very interesting 2 days, and I've had some time to reflect on the comments that have been made during the presentations and by questions from the audience. I think it is clear there are many unanswered questions, and I think that the poison centers, for instance, can be very helpful in attempting to get at some of the information and some of the health signals that are in the country with the use of these products. It's been very clear that these products are in high demand and they're used by many people. And there are still questions, obviously, of are there any issues with the product use? And it's not only these products, but there are many products that people have questions about how they're used and are there any issues with these products. So I would like to propose that we need to look better at the poison center data. We've been focusing on primarily in the papers that were presented and the data that I presented, they were single exposures, so one person, one product, one exposure. There's been some interest, some questions have come up about people mixing things together, using perhaps one product and maybe introducing ethanol or introducing other drugs with the product. We need to look at those types of exposures. And the Poison Center database actually really lends itself to those type of investigations. With the point of who you're going to call, I think poison centers are staffed by healthcare professionals, and it is if people wanted to undertake a project, to let people know that a poison center, we need to change our name from poison to something else, but the poison centers can be a place where people can call to report issues with products, along with the FDA systems, with the internet and such. And we need to educate the public, because I think everybody does agree that it's underreported. If there's something going on with many products, it's underreported. And we need to educate folks. This is a place where one can call, talk to a healthcare professional. We can gather data in a systemized way, and for cases that seem to be major outcomes or severe effects, we could investigate those under public health right away, because it's very difficult, as you all know, to get information about a case that's 6 months old. And we need to know now what's going on. So all of these things are ways poison centers can be used. It is also clear from the discussions that poison center data must be carefully interpreted, and there are many nuances to the data. So from the poison center side, certainly want to work with members of the committee, members of the audience, to make sure that the interpretation of poison center data is correct. And then one of the other mechanisms that we have is the surveillance system associated with poison centers, where we can notify folks about index cases or cases that meet certain criteria in syndromic surveillance. So that can be done. And so I think so that's the contribution, I think, that the people who staff the 57 U.S. poison centers, the nurses, the pharmacists, the physicians, can help provide to add clarity to this issue, which obviously it's clear this may or may not be an issue, but we need to find out, and we need to find out what populations are most at risk, if any, to these particular products. And there are many products out there that we want to know what are their health effects, if any. So that's what I would propose to the group that we should consider in this process. Thank you.